Hey everyone, Dr. Christopher here, and today I want to tell you about one little kitchen spice that might be doing more for your body than half the stuff sitting in your medicine cabinet, and it costs about a nickel a day. I'm talking about clove, the same dried little bud you toss into holiday baking, and I promise you, by the end of this video, you're going to look at your spice rack completely differently. If you're in your 50s or your 60s, or you've got parents somewhere in that range, this is one of those videos where you might want to grab a pen, because a few of these details genuinely surprise me, and I've been doing this a long time. We're not just talking about a nice smelling spice for your apple pie, we're talking about a little brown bud that scientists keep pulling into the lab over and over again, decade after decade, trying to understand exactly why it does what it does. So here's the bold claim right up front. Researchers have logged well over 130 different patent applications involving clove and its extracts. Everything from wound care to natural pest control to oral health. And that alone should tell you this is not just some old wives' tale your grandmother believed in. Let's start with the most well-known use, and that's dental pain. If you've ever had a toothache flare-up at 2 in the morning with no dentist in sight, clove has been the go-to remedy for centuries, and there's a real reason for that. It contains a natural compound that acts almost like a numbing agent, similar in some ways to how a dentist numbs your gums before a procedure, except this one grows on a tree. In fact, if you walk into almost any dental office today, there's a decent chance one of the materials they use for temporary fillings or dry socket treatment still contains this same clove-derived compound, because even with all the modern synthetic options available, dentistry never fully walked away from it. That alone should tell you something. An entire profession built on cutting-edge tools and materials still keeps a plant compound in its toolkit because nothing quite replaces it. Most of the benefit people talk about comes down to one specific oil inside the clove bud, and that single compound can make up somewhere around 75 to 80% of the total oil content. Now here's something I always like to point out. When you get a compound straight from a plant instead of a lab, you're getting the whole package, dozens of supporting nutrients working together, not one isolated molecule. And that matters more than people realize, because researchers estimate that roughly half of modern pharmaceutical drugs actually started out as a plant compound that got isolated and synthesized in a lab so it could be patented and sold. Clove just never went through that process, it stayed whole. Now here's the part that surprised me the most when I started digging into the research, and this is the wait, this changes everything moment, so stay with me. Plants can't run away from threats the way animals can, so over millions of years they developed their own chemical defense systems, mostly aimed at the biggest threat to any living organism, microbes. Bacteria, viruses, fungi, parasites, you name it. And clove happens to be one of the most heavily studied plants for exactly this kind of broad-spectrum defense. Multiple laboratory studies have found clove extract shows activity against bacteria, certain viruses, fungal overgrowth, including Candida, and even some parasites. This is a big part of why it's traditionally been used for oral health, because so many common mouth issues, plaque buildup, gum irritation, that fuzzy feeling after not brushing, are related to an overgrowth of bacteria or biofilm in the mouth. Some people even use diluted clove oil on the scalp, since scalp irritation and flaking are sometimes tied to a fungal or microbial overgrowth on the skin. And a few small studies have looked at whether clove-derived compounds can help calm that kind of overgrowth and even reduce some of the byproduct irritation those organisms leave behind on the skin. I want to be careful here though, this is not a guaranteed fix for dandruff or scalp conditions, and if you're dealing with persistent scalp issues, please see a dermatologist rather than relying on a kitchen spice alone. But it's another example of how one small plant compound keeps showing up in completely different corners of health research, from your mouth to your gut to your skin. Now, before anyone gets the wrong idea, I am not telling you clove cures any disease, and you should absolutely talk to your doctor or dentist before adding anything new to your routine, especially if you're on medication or dealing with a health condition. This is general information, not a replacement for medical advice. But here's a study finding that genuinely stopped me in my tracks. In laboratory research looking at antibiotic resistance, adding a clove-derived compound alongside a standard antibiotic dramatically increased its effectiveness against certain bacteria. In some lab models, researchers reported the minimum concentration needed to stop bacterial growth dropped by an enormous margin. In plain English, that means in a lab setting, far less antibiotic was needed to get the same bacteria-killing effect. And why does that matter for someone in their 50s or 60s who isn't a scientist? Because every single time we use a full-strength dose of antibiotics, we're not just killing bacteria, we're accidentally training the toughest survivors to become resistant superstrains, and then they pass that resistance on. It's basically evolution happening in real time inside your own body. So anything that could potentially help medications work more efficiently, using less of the drug for the same result, is worth researchers paying attention to, and clove keeps showing up in that conversation again and again. All right, before we go further, if this kind of deep dive into everyday kitchen ingredients is something you enjoy, go ahead and hit that subscribe button. It's free, it takes 2 seconds, and it makes my editor do a little happy dance every time the subscriber count ticks up, so really, you'd be doing a stranger a favor. Now let's talk gut health, because this one doesn't get nearly enough attention. There's a specific bacteria called H. pylori that lives in the stomach lining of a huge percentage of adults worldwide, and it's strongly linked to ulcers, chronic gastritis, and ongoing digestive discomfort like bloating and gas. Several studies have looked at clove extract's effect on H. pylori specifically, and the early results are promising, showing it may help inhibit the growth of this particular bacteria and support a calmer digestive lining overall. Now, I'm being a little sarcastic here, but besides helping with ulcers, gastritis, indigestion, bloating, and gas, clove apparently doesn't do much else for digestion, which, if you've ever dealt with any of those issues, you know that's actually a pretty impressive list on its own. There's also emerging research on inflammation more broadly, with some studies suggesting clove compounds may help calm inflammatory markers in the body, which is exactly the kind of thing that matters as we get into our 50s and 60s, when joint stiffness and general aches start creeping into daily life, and simple things like opening a jar or climbing stairs start to feel different than they did 20 years earlier. On top of that, researchers have looked at how certain compounds in clove interact with specific enzyme pathways in the body, the same general category of pathway that some prescription mood support medications are designed to influence, which is part of why clove has such a long history in traditional wellness practices as something people reached for when they wanted to feel a little more level and calm during a stressful stretch of life. Now, I want to be very careful and very clear here. This is not a substitute for any prescribed medication, and if you're on any kind of mood-related prescription, do not adjust anything without talking to your doctor first, because certain combinations can be genuinely dangerous. Separately, some early laboratory research has also explored clove's effects on abnormal cell growth, including specific interest in lung tissue studies, though again, this is still early-stage laboratory research, not a treatment, and nobody should ever substitute a kitchen spice for actual medical care, screening, or a doctor's guidance. Now let's talk safety, because I always want to give you the full picture, not just the highlight reel. Clove oil specifically, not the whole dried bud, is potent, and researchers generally recommend staying well under about 2.5 milligrams per kilogram of body weight to avoid any toxicity, because yes, you absolutely can overdo even a natural compound, and in high enough doses, clove oil has been associated with liver stress. Some people also have allergic sensitivities to clove, so if you notice any irritation, stop and check with your doctor. And if you're pregnant or breastfeeding, medical guidance generally recommends avoiding concentrated clove oil altogether, sticking to normal culinary amounts used in cooking instead. This is a spice with a genuinely long track record, historical use going back roughly 3,000 years across India and China, valued in traditional medicine systems long before modern labs existed, to explain why it worked. Ancient traders actually fought over control of clove-growing regions because it was considered that valuable. Entire trade routes were built around moving this one spice from island-growing regions to markets thousands of miles away, and physicians in multiple ancient cultures independently arrived at similar conclusions about its usefulness for the mouth, the stomach, and general vitality, long before anyone had a microscope to explain the mechanism. It's one of those rare cases where centuries of traditional use and modern laboratory findings actually line up pretty well with each other, which isn't always the case with traditional remedies. So when it does happen, it's worth paying a little extra attention. Let me tell you about a patient story that really drove this home for me, and details have been changed to protect privacy. There was a woman in her 60s, we'll call her Margaret, who came in complaining about recurring mouth sensitivity and mild gum irritation that her regular routine wasn't touching. After ruling out anything serious with her dentist, she started incorporating clove into her oral care routine under guidance, alongside her normal brushing and flossing. Nothing extreme, just consistent daily use. Within a few weeks, she mentioned that the irritation had calmed down noticeably, and she felt like her mouth simply felt cleaner throughout the day, to the point where she actually asked her dentist at her next cleaning if anything had changed, and her dentist mentioned that things looked a bit healthier than the visit before. She also told me she felt a little more relaxed heading into a genuinely stressful few months at work, though she was quick to say she couldn't be sure how much of that was the clove and how much was just finally getting a full night's sleep again. Now, that's one person's experience, not a clinical guarantee, and results absolutely vary from person to person. Some people notice a difference quickly, some notice very little, and that's completely normal with any natural approach like this, but it's a nice real-world example of how something this simple and low-cost can genuinely fit into someone's daily wellness routine without turning life upside down or requiring some complicated new regimen. So here's my practical takeaway for you. If you want to try incorporating clove, whole cloves, clove tea, or food-grade clove oil are the most common approaches. Some people simply chew one whole clove and swallow it. Some prefer steeping 2 or 3 whole cloves in hot water for a warm tea. And others add ground clove into cooking, which is honestly the gentlest and safest way to start if you've never used it before. Whatever method you pick, always start small, pay attention to how your body responds over the first week or two, and always check with your doctor first, especially if you take any medication, are managing a chronic condition, or fall into one of the higher risk categories we just talked about. This isn't about replacing anything your doctor has recommended. It's about adding one more simple, well-studied tool to a healthy daily routine, the same way you might add a daily walk or an extra glass of water. Small, sustainable, and easy to keep up with long term. I've genuinely found it fascinating how something this small and this old, a spice that's been sitting in kitchen cabinets for thousands of years, keeps showing up in modern laboratories, generating this much interest from researchers. Before you go, if you found this helpful, drop a comment and let me know if you've ever used clove for anything. I read every single one. And if you want more breakdowns like this on simple everyday ingredients that might be doing more than you realized, stick around because that's exactly what this channel is all about. Take care of yourselves, and I'll see you in the next one. This is Dr. Christopher, signing off.